Welcome to Grant Rounds in Urology's UrEdge Learning Center. I'm Diane Newman. I'm a urology nurse practitioner and the Senior Editorial Director of Grant Rounds in Urology. And I'm really excited today because I've invited a colleague of mine, Leah Holderbaum, who's an occupational therapist. She was involved with me with research on intermittent catheterization, and she has a wealth of knowledge on currently what she's doing with teaching patients. Her current position is medical supply educator for New Motion. So welcome, Leah.
Thank you so much. I'm so happy to be here with you all today. So what we're going to be addressing over the next little bit of time is intermittent self-catheterization and the role of the occupational therapist. Like Diane said, my name is Leah. I am an occupational therapist by trade, and I am currently the medical supply educator for New Motion. I have previously provided education for Hollister and served as a consultant for Coloplast as well as Convatec, and New Motion is supporting my engagement in this education. The objectives for this course, after the end, we are going to be discussing patient factors and considerations for intermittent self-catheterization. We're going to review catheter features and benefits and their functional implications, and we're going to incorporate techniques and strategies to promote independence and long-term outcomes for intermittent self-catheterization. First and foremost, it's really important to have a holistic view of the individual that you're addressing. So some of the patient factors that I wanted to focus on are listed here. First and foremost are the functional performance factors. It was during my time as an occupational therapist at an inpatient rehab facility when I learned that there was so much more to intermittent self-catheterization than just inserting a catheter, draining the bladder, and removing it. It's important to consider the individual's dexterity. Are they able to open the packaging? Is the catheter too rigid or not rigid enough? How does the person do their lower body dressing? Are they catheterizing from a bed, the wheelchair? Do they transfer to a commode? What settings are we looking at for all of those things? Also, it's important to consider their balance, as a lot of individuals that I work with specifically who have spinal cord injury are in wheelchairs, and the cushion that they're on is going to play a part in their balance. Where are they going to be completing their catheterization? How are they doing their transfers, especially if they need to transfer from their wheelchair to a commode, so on and so forth. Next, I want to address the personal factors. Really important to look at who that person is, their roles, their routines, hobbies, interests, goals. That way you can work together with them to really find the appropriate solution and the appropriate product mix when it comes to intermittent self-catheterization. I briefly touched on environmental factors. And if you think about it, on a daily basis, you are not using just one restroom all day, right? You might wake up in the morning, you're using your restroom at home, gas stations, work, restaurants, friends' homes. There are so many different environments and a lot of different settings. So it's important to work with individuals on problem-solving strategies so that they can be independent in navigating their way through some of the challenges that may arise when troubleshooting through intermittent self-catheterization. And lastly, financial factors. It's important to consider that the products that a person chooses, it could potentially go towards, their insurance, their deductible, and there may be a financial implication for them. So working directly with their insurance as well as a provider that can support their insurance, providing the appropriate products, and making sure that it is within that person's preferred range, preferred product to provide the appropriate items. Getting into catheter features and benefits, I'm going to directly relate these to the patient factors for individuals and how they carry over with independence for intermittent catheterization. So for starters, we're going to address the length, French, tip, the type of lubricant, and whether they are coated or uncoated catheters, as well as the gripper and the rigidity of the catheters. This is just going to give a little bit of background about the different types of features and benefits. So first is the length. Those individuals with male anatomy may choose to use a male anatomy length catheter. Those range from 16 to 25 inches. The reason for the variation in length is due to the urethral length, as well as some individuals may choose to guide that funnel directly into the commode to drain. So that extra 9 inches or so is going to be beneficial in promoting that independence. Someone with female anatomy is going to use a catheter that may be about 4 to 6 inches long. And again, that's going to accommodate for the change in the urethral length. That being said, someone with female anatomy may choose to use a male anatomy length catheter. And the reason for that is because once that catheter is inserted into her body, there's only going to be a few inches that are exposed if she is using a female anatomy length catheter. So if she uses a male anatomy length catheter, it gives her a little more surface area to work with and she can be more independent. There's also a pediatric length. These typically range from about 6 inches to 16 inches. And the reason for that, again, is to accommodate the change in urethral length as these kiddos are growing. And then eventually they may choose to transition to the female or the male anatomy length catheter, depending on their preferred length. Next, I want to address French size. And French size is the circumference of that catheter. So it's that how large that lumen is. And pediatric catheters typically range from about 6 to 12 French, whereas the adult catheter is going to range from 14 to 16 French. Again, that is just accommodating for the difference in the urethral sizes. It's really important that the individual has the appropriate French size catheter. And the reason for that is because if it's too large, it can be uncomfortable or it might actually cause a little bit of pain. And that's definitely not what we want. Intermittent catheterization should not ever be painful. On the other side of things, if the catheter is too small, often urine can leak around it. And so that's not going to be conducive for health and independence either. Next, I want to address the tips of catheters. The first is going to be a straight tip, meaning that catheter tip is straight. They can have different types of lubricant, different types of features and benefits, but if that catheter tip is straight, that is indicated for urinary retention. Whereas a coude tip catheter is going to be indicated for someone who might have an enlarged prostate, a urethral stricture, a buildup of scar tissue, or any other condition where, for whatever reason, that standard straight tip catheter is not able to get past. So that coude tip catheter has a little bit of a curve or a bend, or there might be kind of an olive tip to it. And the reason for that is because it allows it to advance past whatever that barrier is within the urethra. The last tip that I want to address is something called an introducer tip. What is so valuable about the introducer tip is that it allows the individual to insert a catheter into the urethra, and that special introducer tip serves as a protection so that the catheter goes into a cleaner portion of the urethra, whereas most of the bacteria collects on the distal portion. That way, it won't drag all of that bacteria directly through the urethra. Getting into the lubricants. This is, again, 100% dependent on whatever the individual wants to use. Some individuals prefer to use a gel lubricant. Some individuals may prefer to use something called hydrophilic, which is watery, a little more slippery. Again, it is completely up to the individual as to whatever their preference is. That being said, uncoated and coated catheters are the two main types. An uncoated catheter is one in which a separate gel lubricant must be applied. A coated catheter is one that has a kind of like a, lack of a better term, a coating on it. And there is typically a saline pouch or like a little sterile water solution within that catheter, and it must be popped prior to opening that catheter to activate the coating, which is the lubricant for that product. The other option would be a gel pouch. Some catheters come with a little pouch of gel directly in that packaging, whereas others are going to come with, again, that little silver sachet that you have to pop. This is important to consider when it comes to dexterity. You really need to think about, is the person able to open that packaging? Are they able to open the gel packaging? Are they able to squeeze that gel onto the catheter? On the other side of things, are they able to pop that sachet? I will be honest, I have two good hands, and there are some little silver pouches that are a bit challenging to manage. So I definitely encourage you to assess dexterity and make sure that that individual can be independent in that instance. The other two options are going to be your pre-lubricated gel or your pre-lubricated hydrophilic. These types of products are ready to use right out of the package, meaning you don't have to apply a separate pouch of gel lubricant. You don't have to pop anything. They are ready to use. So in this instance, something that is pre-lubricated might be beneficial for someone that does have dexterity issues, as it's going to be more simplistic and efficient and ready to use right out of the package. Next, I want to address grippers. And grippers are typically made from multiple materials. And they are usually they're anywhere from about an inch to about 3 inches long. And they are going to go over the surface area of that catheter. And what is beneficial about these is it helps to reduce the contamination because the individual has that protective sheath over that catheter, and they can advance it throughout the entire catheter without ever contaminating it. It also helps with ease of insertion. Some catheters are a little more floppy than others, they're less rigid. And so, that being said, that gripper helps to promote independence when it comes to dexterity for that ease of insertion. Lastly, I want to address catheter materials. The reason these catheter materials are important is because it's really going to play a part in the rigidity of the product. Typically, latex catheters are going to be the least rigid. So, that being said, think about trying to insert a cooked noodle that's a little bit, soft into kind of a small hole is going to be more challenging. Whereas inserting something that is more rigid, such as a pen or a pencil, is going to be more easily inserted. So that would be your PVC type product. Next, I want to address the idea of male positioning in bed. And the reason for that is because it's really important that individuals learn to cath in a variety of settings, and you want it to be very comfortable. So, depending on the individual with male anatomy, he may choose to initiate his cathing education in bed, or he may choose to initiate his cathing education in the wheelchair. But being versatile in all of these different positioning strategies is going to be crucial. So you can see here, my friend Anthony is demonstrating male anatomy positioning in bed. Usually I encourage folks either to prop themselves up on their headboard, or if they have a wall, kind of use a pillow to get a little bit of that sacral sit, that posterior pelvic tilt. That way you're going to have your hips open and you're not going to have a lot of pressure on the bladder, and you'll make sure that the bladder is fully emptied of any urine that has been retained. In the next photo, you see my friend Anthony again demonstrating intermittent catheterization from the wheelchair. And again, what he typically does is he'll scoot his hips forward onto his wheelchair a little bit, recline back a little bit. Again, that's just to open that hip angle so that he doesn't have pressure on the bladder. He'll insert the catheter to drain and he'll be done. It is important to note in the picture where he's demonstrating intermittent catheterization in the public restroom that once the catheter is inserted, it is not going to reach the commode. Once it is in his body, it will not reach the commode. So he would either need to have a urinal or an extension tube, or he may choose to drain into a drainage bag. So that being said, problem solving through some of the strategies for management of those supplies. Where is he going to store them? He may not have enough hands for all of that. So also looking at potential adaptive equipment, which I'll show you momentarily as well. Next is positioning for female anatomy. And again, typically initiating catheterization where the individual is going to be comfortable. Most of my individuals with spinal cord injury and female anatomy typically began their intermittent catheterization in bed, And the reasoning for this is just because it's more simplistic based on the anatomical differences. So again, you can see here, my friend Catherine is demonstrating a very drastic sacral sit, posterior pelvic tilt, and she has her legs butterflied out. She's really got that nice angle, so she has optimal urethral access. Once she is fairly comfortable and confident with that strategy, we might transition to her being able to cath from the wheelchair. Again, this is much more dynamic than what it looks. We have to consider her clothing management. Is she going to take her pants off before she gets into this position? Does she need to take one or both legs out of her pants? Does she want to manage one or both legs onto the commode? And what's so fun about this, specifically with those with female anatomy, is it's never a one size fits all situation. And it is always problem solving and troubleshooting through and working with patients to figure out the best strategy. Again, to reiterate, it's important to note that in these cases, this catheter, once it is inserted, it is not going to reach the commode. So she would need to either have a urinal or a drainage bag or an extension tube for that collection. And lastly, you see here my friend Catherine demonstrating intermittent catheterization directly over the commode. Some individuals with female anatomy may choose to transfer onto the commode for ease and efficiency or just based on the environment and setting. So again, it's important that we are providing our patients with this education on all of these different strategies so that they can learn to problem solve and troubleshoot through any of the different instances and environments in which they might need to complete their intermittent self-catheterization. Now I want to address some adaptive equipment. Again, we're really looking at a holistic view of the individual. So dexterity is something that is very important, and it's a crucial piece of intermittent self-catheterization. When it comes to opening the packaging, managing the catheter, managing your clothes, managing all of your supplies. So looking at some adaptive equipment is going to be very valuable for individuals. So here I have two pieces of equipment that are beneficial when it comes to catheter insertion. One is actually called a catheter inserter, and it serves as a kind of like a universal cuff. It goes around the hand, and then that clamp actually holds a catheter in place. So someone without any sort of dexterity or finger movement can be independent with their bladder management. In that next photo, you see my friend Mark. He has a company called Abilities, and he uses a 3D printer to make devices. So this is his version of the cath clamp. And what's great about this is it's also very versatile. Those loops can be managed in a multitude of different ways. And again, that clamp is easy to manage specifically for individuals that don't have great dexterity or finger function. These are two pieces of adaptive equipment that are really valuable for individuals with female anatomy. The one on the left is something called the AstaCath. This was designed by a nurse named Linda Asta. And that kind of like triangle portion, once that is lubricated, that is going to go directly into the vagina. The sides are going to serve as a labia spreader. And one of those three holes is going to line up with her urethra. So it'll give her that visual guide, that feedback of where she needs to target her catheter during intermittent catheterization. It also has a nice loop over the side of it so that individuals who have dexterity issues are able to access it more easily as well. On the other side are washable and reusable incontinence panties. These are called Speaks by Thinks, and these are absolutely fantastic. Individuals that might have a little bit of leakage between intermittent catheterization, or if they have some, stress incontinence during transfer completion, these are fantastic. Different cuts, colors, sizes. It is a very valuable resource for those with female anatomy. These are two options for holding clothes out of the way. As I previously mentioned, specifically for individuals with male anatomy, no one has enough hands to manage their anatomy, hold their clothing out of their way, hold all of their catheters, potentially a urinal, a drainage bag. So anything that we can do to alleviate a little bit of it, let's problem solve, troubleshoot through, and figure out a solution. So on the left, there is something called the pants holder, or the name brand version is called the Betty Hook. There are versions that are available in kind of, that metal version, or there's another one that's plastic, just again, depending on preference. And this is fantastic for individuals that complete intermittent catheterization from the wheelchair because it holds their clothing out of their way. There's a bar that goes directly between their cushion, their wheelchair cushion, and their seat, and it holds it in place. There's a hook at the top of that bar, and then the other end goes directly into the pants to hold everything out of the way so the person can be hands-free. On the right side, you see a bungee cord. You can get a package of these at Lowe's, on Amazon, very cost effective. You tie one end around the frame of the individual's wheelchair, and then you can grab the other end with they can use their finger or their thumb. Again, you don't have to have great dexterity to be able to utilize that. And the individual can then engage their bicep to hook the other end of that bungee cord in their pants, and the resistance of the bungee will hold their clothing out of their way, making it easier for them to perform intermittent catheterization. Here is a version of the penis stabilizer. Again, anything we can do to make it easier for those with male anatomy, let's alleviate any of that stress. So this is an object, this is a piece of adaptive equipment that will help them in maintaining the appropriate positioning during intermittent catheterization. So thinking about specifically someone with male anatomy in a wheelchair, seated in a wheelchair, they are going to have to wash their hands, manage their clothing, then they're going to have to manage their anatomy, catheter, everything else. So this holds the penis in an upright position. And the reasoning for that is the urethra is S-shaped. And so you want to extend the penis upward for proper alignment with intermittent catheterization. And that's where this penis stabilizer comes in place. It is a very flexible foam, and it is, again, designed for individuals that could potentially have dexterity issues. They can hook their thumbs or their fingers in those loops, open it up, cradle it around their anatomy, and it keeps it in the appropriate position. This is an alternative version. This is something called the household, and it was actually designed by a doctor who has dexterity issues himself. And it serves as for, it's kind of like a little teepee. Again, it keeps the penis in the appropriate position for intermittent catheterization, and it's geared towards individuals that have dexterity issues. They can hook their thumb through that loop, bring the semicircle around their penis, and then connect the Velcro, and it'll keep the penis in the upright position for intermittent catheterization. Next, I have two additional options. On the left, you see something called the Uroluge. This is going to be ideal for individuals. Number one, it's going to hold their clothing out of the way. Number two, it serves as that extension tube to allow for urine drainage directly into the commode. And lastly, what's great about it is if you see that opening where the catheter is going in, it holds the catheter in place. The reason for that little comma design is that the individual can put the funnel of the catheter in the top of that comma, bring it down, and it'll latch in place. So again, they can be more hands-free. On the other side, you see the urinal cath cap. Again, that has that same comma design to hold the funnel of that catheter in place. That way the person doesn't have to worry about maintaining the hold on that catheter the entire time. And next is the cath lap system. So again, thinking about if the person has to hold a urinal or hold a drainage bag, there need to be options for adaptive equipment so that they can be more hands-free. So that's where this cath lap system comes into play. It is, again, geared towards individuals that have dexterity issues. It's got those nice loops so that individuals can hook their thumbs, fingers in there. It's very easy to put together. The person will cradle it on their lap. That hook of a urinal can actually go directly on that bar, or there are little hooks on the other side, and the individual can hang the loop of a drainage bag directly onto that cath lap system. And next, what I'm going to do is show a video of one of my dear friends named Catherine, and she demonstrates the dynamics of intermittent catheterization. So I've spoken a lot about dexterity, I've spoken about balance. I've spoken about the cushion, the type of, wheelchair and equipment that they're in. And it's really important to, understand the dynamics of intermittent catheterization, specifically for individuals who are completing it from a wheelchair, so that you can have a broader idea of some of the barriers that may arise. So first and foremost, what you see is that she is advancing her hips onto the edge of that seat. And that is what the majority of individuals do. So she has to have, number one, balance that is good enough so that she is able to do that. Also, she has to have the dexterity or some sort of hand function and upper extremity function to be able to complete her lower body dressing. Now you see she is balanced again on the edge of her seat. She achieves the very significant posterior pelvic tilt. And again, the reasoning for that is because in order for someone with female anatomy to have optimal urethral access, they have to be scooted incredibly far forward on the edge of that seat. In Catherine's instance, she does have really good dexterity. She has had significant improvement, so she is able to, complete this very independently. It was not always this easy though, and it does take time and practice and problem solving and troubleshooting. And I think that's part of the significance and the value of working in conjunction with occupational therapists. You can see there, Catherine also utilized a mirror. And the reason she utilizes that mirror is for visual feedback. So if an individual with female anatomy does not have sensation, they may choose to use a mirror so that they can visually see where their urethra is. So, in summary, occupational therapists, we have a very distinct role when it comes to bladder management. And it is something that I didn't know much about. And I started researching and I became very passionate about it because I saw the value of working with the collaboration of the entire team. So, that being said, occupational therapist, again, we're looking at the holistic view. We're looking at the physical skills of the person, their cognitive and emotional status. Are they able to comply with their intermittent catheterization regimen? And are they even in the mindset to carry it out? Looking at the type of equipment that they're in, whether it's wheelchairs or implementing adaptive equipment, their roles and routines. Who is this person? What do they value? What are their cultural and spiritual beliefs? The environment and environments in which intermittent catheterization is going to take place. If they are a stay-at-home mother and they have, kids at home and then they have to cart them to ballet and basketball, really looking at all of those different environments to make the appropriate recommendations. Bowel function. Bowel and bladder go hand in hand, specifically when it comes to incontinence, constipation. So making sure that you're addressing bowel function as well. Looking at support from family and caregivers, and again, overall financial considerations. So as I was pouring into all of my research over time with all things bladder management, everything that I read regarding the goal for bladder management had to do with UTI and infection prevention. And I couldn't agree more. That is incredibly important. But I wanted to take it a step further. And I like to look at the individualized approach because intermittent self-catheterization and bladder management are not one size fits all. So I wordsmithed my own version of the goal for bladder management, and that is complete bladder emptying in a way that is conducive for the individual's lifestyle, functional performance, and quality of life while also preventing infections. And in these photos, you see three of my dearest friends, and each of them are completely different. They have completely different values, completely different careers, family dynamics, roles, hobbies, interests, and every single one of them utilizes a completely different product mix and a completely different strategy. And it really goes to show that intermittent catheterization truly is not one size fits all, and some individuals might choose more than one product or more than one regimen, and really looking at the person holistically to figure out what is going to be their best strategy for overall health. So in summary, intermittent catheterization education and teaching, it has to be interdisciplinary it has to be responsive, and it has to be reality based. Meaning it's not just nursing teaching it, it's not just occupational therapist, it's not just important for the physical therapist to address balance and strength. It really needs to be a collaborative, cohesive approach between multiple disciplines, as well as the individual and their family. Intermittent catheterization, it has to be responsive, meaning the individual must have active removal of that urine and it must keep them healthy. And it has to be reality based. It has to fit into their lifestyle, their routines, and who they are. Intermittent catheterization is dynamic. You saw in the video with Catherine, balance, transfers, clothing management, strength. There are a lot of little pieces to it, and problem solving and troubleshooting through that strategy is going to be a critical piece for that independence. And again, intermittent catheterization is not one size fits all or fits most. I have taught so many individuals how to complete their intermittent catheterization, and not one patient has used the same strategy or the same product or the same adaptive equipment. And I think it's really important that we continue to focus on the person on the other side of intermittent catheterization so that we can provide the best possible outcomes. So again, the take-home message is collaboration with OTs for intermittent self-catheterization can facilitate increased independence, health, quality of life, and so much more. And as an occupational therapist who's been on the other side of things, providing, the education and training to individuals, I have seen it firsthand so many times how life-changing it is for these individuals when they go from dependence to independence with their bladder management. With that, thank you so much. I have my contact information here. I am always happy to answer questions, stay connected, be a resource to anyone. So I'm more than happy to be a resource.
Thank you so much, Leah. That was really excellent. And, what you really highlighted is the complexity of catheterization, especially in those individuals who are not mobile, right? They don't have dexterity. And I
Mhm.
think that it's really, as an occupational therapist, you really provide so much expertise in how to work through some of those challenges.
Thank you. And that's something that occupational therapists do have a special skill in, that is breaking the task down and really providing, that analysis and problem solving and troubleshooting through. So we do have a significant value in this area.
Yeah, now and you're doing right now a lot of education in this area, right? With patients directly. Is that what your role is?
Yes, I work a lot with clinicians and helping them, educating them so that they have the resources and the tools to advocate for their patients, educate and train their patients, and empower their patients to be more independent. So it
And
is.
yeah, and you brought up a lot of, interesting kind of adaptive type of equipment that you can utilize for self-catheterization. And
Yes.
I know patients are always searching for those. Where do you find those types of devices and products?
I have actually found a lot of the devices and products by just getting on Google and typing something in, and it'll take me there. Also, Amazon has a lot of resources. I also have a spreadsheet that I keep of adaptive equipment and the indications and costs that I would be happy to share because it's
That
so
would be
valuable.
Yeah, that would be wonderful. We could post that as a PDF. So if you could send that, that'd be really great. Thanks
Absolutely.
so much for this presentation. It's going to be so helpful to our members and to our audience. So thank you.
Awesome. Thank you so much, Diane. I appreciate it. It's a great opportunity.